Today's Good Health segment is brought to you by Horizon Health.
We are here at Horizon Health in Paris, Illinois, and today I am very happy to be standing with Dr. Elliott, who is a clinical psychologist, and we're here to talk about March being National Social Workers Month. First of all, thank you for inviting me into this really cool office.
Well, thank you.
Before we're done, I'm going to make you play that trumpet
All
for
right.
me. What do you think?
I don't know. We'll have that. We may have to negotiate.
We'll negotiate for that at the end. Let's talk about the importance of social workers by first of all maybe telling me, what does a social worker really do?
Well, a social worker is one of the most important mental health professionals out there, really indispensable to a psychologist, a psychiatrist, to anybody in healthcare, because they get into all facets of patients' lives.
So when it comes to social workers, what types of counseling then do they offer to individuals?
Well, licensed clinical social workers can conduct diagnose and treat mental illnesses just like other mental health professionals.
Okay.
But they also have the experience and training to do casework management kinds of things so that they can help people with housing, finances, Social Security disability applications, things like that. The social workers really embody the notion that you can't treat someone until their basic needs are met.
As you describe them and you tell me all the things they can do, I have to think there must be quite a bit of training and credentials that go along with this job.
Well, to be a licensed clinical social worker, the person has to have a master's degree in social work. A licensed social worker doesn't require the supervised experiences, but they're much more limited in what they can do.
Okay, and I assume they're very important in what you do each and every day.
Oh, yes. I mean, just to give you a couple of examples, I see a number of women who are struggling in relationships that are very toxic. So social workers help me find ways to extricate them from those relationships and get to a domestic violence shelter, and then eventually find an apartment maybe in another town, arranging for transportation to bring them to appointments.
Wow.
When they don't have their own vehicles.
You know, I hear you saying that. You told the story of women, but I have to think there are a number of individuals who benefit from the services that a social worker provides.
Oh, absolutely. I will take someone from my office to a social worker and connect them with resources within the hospital, other medical resources. Oftentimes there's a need for food stamps. They really have their hands in just about everything.
What's the need like as far as the need for people in this job right now? Is it a high need?
There's a high need for mental health professionals in all sectors, particularly in rural communities like Paris and Edgar County, Illinois. In fact, there was a community needs assessment conducted a few years ago, and the #1 item was mental health services.
Wow. You think about that, and then you think about what they do here at Horizon Health. So can we talk about that specifically here at Horizon Health? What role do they play as far as the hospital setting goes?
We have 4 social workers currently.
Okay.
And they provide mental health treatment.
Okay.
Like I do. You know, the key word with social workers is connecting. They connect patients with all kinds of social and other services that are available in the community.
Such an important role that they play, and such an important month then to recognize these individuals.
I'm just excited that they have their own month. They deserve it.
And beyond this month, they deserve recognition all the time.
They do.
Tell me about you and your job here. What does it mean to you to be able to touch the lives of so many people?
It's a privilege. It's an absolute privilege. You know, my background is almost entirely in the world of prisons and jails.
Oh, wow.
So I now am working with a different patient population, and I see patients from ages 5 to 87.
Oh, wow.
And it's just exciting for me, and a real privilege to be here and be part of building a behavioral health program at Horizon Health.
Wonderful. You have a servant's heart, I can tell, just by talking to you, by hearing your story, and by hearing your talk about social workers. You can just tell when people's hearts are meant to do what they do. So other than play a great trumpet, I can tell you're meant to serve the needs of people. Congratulations on that.
Thank you, and it's very kind of you.
Well, it takes a special person to do it. Here at Horizon Health is where you'll find the kind of help that you're looking for. Of course, we thank you for your time today, Dr. Elliott, and it is Social Workers Month, so thank a social worker, please.
And you can find a Horizon social worker or other care provider by logging on to myhorizonhealth.org, or you can just call that number right there on your screen.